I'm 65 years old. 30 years ago, I've had multiple surgeries, but 30 years ago I had a doctor who was doing a bone scan tell me then I had the bones of an 80-year-old woman. Well, that was 30 years ago. Now I'm kind of like bone on bone, and I have discs that aren't where they should be, and it's just pretty well messed up. I tried pain medications, but all that did was just mask the pain. It didn't cure the problem. Anybody that's ever had any kind of back pain, they know what that pain's like. No pun intended, but it was worth the shot. As far as the procedure itself, I've had worse manicures. They deaden the area with lidocaine, which is not painful, and then the doctor injects it. And you don't feel anything other than relief. And I can't say enough about it. It's one of these procedures where it sounds too good to be true, but it isn't. The way things are nowadays, everybody, of course, they need to watch their money and the economy and all of that. This was one of the best things I could have done for myself. And all I can say is, don't cheat yourself out of life. You're worth it.
When I was 24 years old, my little cousin came to me. He's like, do you want to play a pickup football game? And I said, yeah, because I love football. I played football all through high school, never gotten injured. And this one time with my cousin, I ended up actually tearing my ACL. A lot of it was my fault. I didn't follow through with any of my aftercare. I was 24, I thought I was invincible. But turns out for a solid 6 years, I walked with a pretty heavy limp, which led to some substantial back problems. I was a little skeptical. It sounded a little too good to be true. Sounded too easy, considering all I had heard before was get ready to have more surgery or get ready to be in pain the rest of your life. Just to have a simple injection do it just seemed way too easy. I had to have 2 injections. After the first one, I'd say I went to like 85%. All my back problems went away with the first injection. Then after my second injection, that's when I got to 95%. It's given me the ability to act my own age again. You know, it's a little embarrassing being 26 years old and seeing all of your friends like running around, and you know, there's times when you have a cane. It's done things for me that I never thought possible, and easier than I ever thought possible.
About 8 weeks out, I was preparing for the Nevada State bodybuilding competition and had a tear in the inner head in my hamstring, and Dr. Smith offered to try a PRP injection with me, and actually I had heard about it because Tiger Woods and Kobe Bryant and Andrew Bynum, a few famous athletes, had already got this procedure done, and it was fairly new, and I heard very good results with it, and I got actually pretty amazing results to where I was back in the gym in just 2 weeks after a hamstring tear. That's a very rapid recovery. It's very simple and safe, and that's what really turned me onto it. It really promotes the natural healing process of your own cells without any drugs or any surgery. Letting your own body and your own blood do the work. I'm feeling 100% recovered. Have probably better use of the one that was injured than the one that was not, just normal wear and tear and everything, but it feels great, 100%.
Well, I was riding my mountain bike, went over the handlebars, landed on my shoulder, ended up with a 3rd-degree AC joint separation in my right shoulder. I was immediately taken to the ER, who told me that I needed to go see an orthopedic surgeon right away. I saw him the next day, and he told me that I needed surgery. I researched my options a little bit more. I discovered Dr. Smith's PRP injections, heard about that, decided to give that a try. So we did 1 round of PRP injections. I went back to the orthopedic surgeon 3 days before I was scheduled to have surgery, and he told me that he had never seen anybody with my type of injury be able to move my arm the way that I could. That was approximately 1 week after the injury. I had full mobility and rotation of my arm. Probably would have been about $5,000 for me to have that surgery, plus 6 to 8 weeks out of work. I couldn't really afford to do it. For me, PRP turned out to be a great alternative for surgery. I live a very active lifestyle. I do a lot of dangerous sports. That's what gives me enjoyment in life. I've got 2 boys also, And my work, I couldn't even do my work with the injury that I sustained. So in order to have that, all of those things back in my life so quickly with the PRP injections and not having to go through that recovery time from surgery, it was well worth it.
Years ago, I began to notice I had a problem with my left hip and my knee. And as I danced, it became more and more of a problem. There was pain in the knee, there was pain in the hip. Essentially, about a year and a half ago, I had to stop competing. I had gone to an orthopedic surgeon who suggested that I need a hip replacement. And I wasn't quite ready to deal with that yet. So as a result, when Kathy came to me and talked to me about this alternative treatment method, I was very receptive to it. And I have to say, during the past 6 months, I've been very pleased with the results. I'm at the point now where I can pretty much dance full out without any pain. And my wife and I are planning to start competing again soon. This is certainly an attractive alternative to some of the other options that may be available to you. There's no trauma involved. It's essentially painless, it's efficient, and it works. So I would highly recommend to anybody who's got that kind of a problem to seriously consider the PRP treatment.
I have multiple issues that have come about over a period of about 4 to 5 years, but my main concerns were my knees and my lower back. And I was at a desperate stage, and PRP seemed to be the way to go. My orthopedic surgeon actually said that he would not do another knee surgery unless he did the PRP. So I agreed with him, and I was disappointed with the result. So we then went ahead with yet another surgery on my knee. I couldn't walk up the stairs, it'd just give way, and I had to pull myself up. So I've known Dr. Smith over the years, and I have faith in her as a person, as a doctor, and I knew that she would not steer me wrong. So I was quite happy to try it again with her. My medical situation today after the PRP treatments I've had with Dr. Smith is, for me, a godsend. She's amazing at what she does, yeah. And she's so sweet with it. Her whole attitude is just lovely, yeah.
I practiced 24 years of emergency medicine, and during those 24 years, I found a lot of problems with our current methods of managing pain and many other medical problems. I swore that when I left the ER and went into the private sector to practice medicine, that I would find the healthiest methods I could to treat our current medical problems, including pain. That's when I fell upon PRP therapy and started working with it. I've been very satisfied with the results. I find that the very best healing comes when you let your body heal you.